Great. Here we are, another Friday. Thanks everybody for joining us. We're just waiting on Paul, but hopefully he'll be with us. He's quite instrumental to this, so I'm hoping he's going to be able to join us. But I'll make a quick start. So for people that joining our first Friday live session, these are all about trying to showcase proactive, solution-based things and projects and initiatives that are going to help support and drive forward public sector and public care and public health. Given what's happened with NHS England this week, I think we need these more and more than ever. Today's a little bit different in that I'm leading it today, or it's my initiative that's leading it today, and I'm about to launch in a few weeks, depending on how today goes. It might be several months if I've got a lot of rework to do, but I'm hoping to get the second book out called The AI Strategic Edge. And before I go into that and start to introduce it, let's just do a quick round robin of introductions. So I'm Anthony Lawton, Fit to Care and Insight Genie. And my drive, as you might already have guessed, is to try and drive transformation and reform within the public services. If I'll then go, I'll start with Angus, if that's all right. If you can do your 60-second intro.
I'm Angus Wallace. I'm Chair and Chief Executive Director of UK DHC, an organisation that was set up in April last year. And we are striving to improve digital training in the workplace for both healthcare and social care. Fantastic.
Andy?
Hi, my name's Andy Wilkins. I run my own think tank, Future of Health, which it does what it says on the tin. I've spent many, many years working in different parts of the health system and seeing its siloed, transactional, short-term nature. But it's allowed me to put some ideas together about what 21st century whole system, whole person healthcare could look like. And I now run a program at Imperial on leading systems innovation in healthcare, how we go from silos to systems. I've been working with at least one of the ICSs on taking these ideas into practice.
Brilliant. So I hope you can see that we've got some really relevant panel members today. I'll hand over to Jose next.
Hello, everybody. I guess I'm a bit different. I'm a master of the dark arts of marketing. I work for the AI solution providers that are marketing and selling their service to healthcare. And I help them produce content and webinars that are, so I'm trying to bridge the gap. So they're serving the market with educational content. And I've lived in the UK for 17 years, but I'm not as conversant with the inner workings of the NHS like the rest of the panel is. So I'm coming from a very different point of view.
No, that's excellent. We need different points of view. Brilliant. And then over to you, Rebecca.
Hi, I'm Rebecca Howard. I am a clinical psychotherapist, CEO and founder of Shiny Mind, and we are all about empowering people to be the best versions of themselves, working extensively with NHS leaders to empower them to embrace change, and also working with patients so they can lead and manage their own health effectively.
Excellent. Just while I do an introduction, is there any chance that one of you guys could send the link to this over to Paul, because he's just messaged, I think, through.
I'm sending it now.
Okay, thanks, Jose. I'll just give a bit of an intro whilst you're doing that then, because Paul is really critical to this, and hopefully as soon as he comes in, I can hand over to him. Let me just see. I can't see him in the dashboard. Okay. The reason I started this second book is that I was talking with Paul Cresswell, who's hopefully going to join us shortly. He's at a Bristol Hospital Trust. And I've been working on AI for quite some time. And for me, it's magical. The amount of productivity improvements that I've made in the last 12 months is off the scale. So I've been working with Bristol Trust for a while, and I've done some work with them with some AI use cases. And Paul has been really interested and really, really keen to get involved. And I'll just let him in now. Hi, Paul.
Hi there. Hi.
Thanks.
Sorry. Difficulties joining, but I'm here now. Sorry about that.
No problem. Paul, we've really just started. Is it worth you just giving a quick 60-second overview of you and your role?
Of course, yeah. So I'm Paul Cresswell, the Director of Quality Governance at North Bristol Trust, so an acute trust in the southwest. And Anthony and I have been talking for a while really about how AI can help someone in my kind of role support our clinical colleagues across a very large acute trust in new ways to get fresh insights. And I think we spend far too much time in our environment trying to work out what we think we know, and not enough time on actually using the insight that we get in a much more intelligent way so that we can make improvement. And so kind of where I'm coming from in all of the discussions we've had, but also more widely when it comes to the sort of digital side of things and AI particularly, is how can we do this in a slicker, more effective way so that we spend the time on how can we make a difference and improve things, rather than what on earth do we think we know across a large hospital, let alone a hospital that is now moving into a very, very large group with our neighbours in Bristol and Weston. And we just spend far too much time trying to work out what we think we can prove from some very poor data sources. But that's the future that we've got to navigate.
Brilliant. Okay, I just started, Paul, to say that the reason for this book really is you. So I don't know whether you're aware of that, but it is absolutely you.
There's a responsibility to take, eh?
So probably, I don't know, 3 or 4 months ago when we were talking and catching up, and we'd done a project with Sue. So we were starting to get into this and we're starting to see the value of it. And then the interaction, the essence that I got from you was, correct me if I'm wrong, but the essence that I got was, I sort of know that AI can radically help what we do and how we do it, because I know there's all this rich data source that we're not currently tapping into. I know I need to do it. I can't quite get to it because I'm completely overwhelmed, and it's really hard to learn something new. And I'm constantly getting bombarded with AI people trying to sell me stuff. Mm-hmm. So I sort of, is that fair enough?
Yeah. I almost, well, at least once a week, probably more. There's a new package that has AI built into it that someone's coming to me and saying is going to change the world that I occupy. And I've got a couple of irons in the fire. One very live system that is, as an example, which I think is a genuinely exciting example. We are using an AI-based product to look at 100,000 sets of friends and family test narrative feedback and do sentiment analysis in a meaningful way. And I think the early indicators of that are that it's going to be very helpful for us and a whole new world. However, that's just one element of looking at quality in the dimensions we're looking at them for ourselves, but then also into the hospital group as we move. And my colleagues that I sit in our office building as we talk about the possibilities of AI, whether it's through the lens of something like Copilot and the building in a Copilot and merging policies and guidelines and that kind of thing, or whether it's deep data and insight into clinically meaningful information. There's a whole range of stuff, and conceptually I completely get it. And I'm excited by it, and I can see the possibilities and opportunity, administration support, etc. But actually to decide, right, where will we start? What's our strategy for this? And how are we going to make that work at scale and impact? That's the dilemma, because there's almost too much of it to process. And then the day-to-day demands just get in the way of actually having any thinking capacity whatsoever at times.
Yeah, absolutely brilliant. Okay, thanks. So we were on the same page, or at least I understood it in the right way. Yeah. I'm glad, because I've just written the book about it. The other thing that at that time, when I started to then think, okay, let's write a book on this because it could be really helpful. Because ultimately, what my goal is to get managers like you, Paul, to feel comfortable. Because there's also quite a bit of fear. I think less fear with you, but certainly a lot of managers in your situation, I think, because they're unaware of it, really. There's fear associated with it. Not understandable fear, I think. Once we get through this, I think we can understand it and manage it so that we can eradicate the fear. That's really what I'm trying to do with the book. So my ambition with the book, if we set this out now so we can debate it and see if I've achieved it and where I can improve, is how can we introduce AI to managers such that it's not a black box and it's magical and there's no logic to it. It's just you don't know what's going to come out of it because it's a black box. I'm going to remove that, and in that case, remove a lot of fear, because it's basically maths, really, complete logic. Second one is then to give you a participatory experience. So back to my first book, I talk about 4 areas of knowledge. We look at propositional academic knowledge almost all the time and make decisions on that basis. But actually, you've got to get involved with the procedural, the perspectival, and the participatory knowledge before you really get knowledge. So I'm trying to lead people through that education piece, getting examples where they can have their own eureka moments and you go, oh my God, I can't believe that I've just done that. And isn't that amazing? And then from that, you can then build on that and go, right, this is something that we can do. We have to do it properly, however, because these are the risks that we have to manage and mitigate, but it's doable. It's like a, oh my God, moment. That's what I'm trying to get across with the book. And the other thing is, I want it to be not like the first book. I want it to be something that you can whiz through. So it's an easy read. You can get through it in one night if needs be, maybe 2 or 3 if you're busy with kids or whatever, but not a thick book that's going to take you 3 months to read. So that's the ambition. So if you can keep those things in mind as we go through, and then I genuinely do want a critique of this isn't working for me. So we'll start off in a minute and say, just do a round robin of these are the things that I think are working in relation to what the objective is. And then we can go through okay, what do we think isn't working? And then I can try and make notes, not too many, because I can replay this so it doesn't get too boring for everyone. Does that sound like a plan?
Mm-hmm.
Okay, fab. So shall I kick off with Andy? I think, Andy, this is the first time you've been on one of these live events. So let's put you in the hot seat straight away.
Oh.
In terms of almost the positives of where I'm getting it right with that objective, if you can kick off and just give us an overview of what your thoughts are.
Yes. I think this is a very valuable contribution to how we might collectively understand AI. I think, taking a step back and looking more generally at all organizations, there's typically been divide between business and tech. Tech speak in one language and have their tools, and business gets on and does its own thing. But AI really does fundamentally offer an opportunity to rethink the business side using tech in a new way. And it's really important that leaders can equip themselves with an understanding of what this technology is capable of doing to be able to address the sort of clinical and health and public service questions that need to be addressed. So I think it does that really, really well. The way that you've articulated in an easy to read, you've laid it out in a nice structured manner. I think it gives people a really kind of solid onboarding of what is this AI thing? Why should we take it seriously? What are some of the myths around it that often people seek refuge in ignoring AI because of these concerns about hallucination or it's about bias, etc. And you've sort of done a really good job of elucidating that. So I think it's a huge step forward in providing people with a general understanding of what this technology is, the sorts of things it's capable of doing, and the transformational nature of it. Excuse me, I'm just getting over flu.
No, thanks for joining as well.
At this moment in time, because there's one of the comments in the chat there that AI itself is evolving rapidly. So what we've got at the moment is simply the start point of an accelerating journey. So it's really, really important that leaders start to get to grips with what this technology makes possible in the now, because in the future, it truly is going to be transformative. So yeah, big thumbs up from me, Anthony. Okay,
brilliant. That's exactly what I was trying to do, Andy. And we'll get into the critique later, so you're all going to have a chance to criticise and improve. So we go to the next new member of our Friday sessions. Jose, what are your first thoughts?
I think I really liked it. I like the fact that you hinged it around the eureka moment, and I think getting people to that is really important. And I like the way you framed it around strategy, and I think that's actually the most important thing. And I also like the way how you positioned it. I think the eureka moment sections, I think it's in the middle of the book. Is that right?
Yeah.
It's kind of hinges around that, and getting people around that. And I think it's because it's what I've noticed with people is if you don't get them to the eureka moment, it's just you're doing a lot of explaining, and they're trying to imagine. And so I really like that. Now, in terms of, I'm also learning the things because I'm used to dealing with startups where everything moves fast.
Yeah.
And you guys are talking about healthcare institutions where things are not. It's a different culture.
Yeah.
And so I'm kind of like, I really feel like I'm on the outside of the house looking in through the window when I'm reading the book. But that framing, the way you structured and you built up to the eureka moment, and then you dovetailed out from that, that was brilliant. That is what you need. Definitely.
Okay, brilliant. Thanks ever so much. Just whilst, I don't know if you've got a bit more to say, but can I jump in? Because there's some feedback from a really close friend of mine he's got good intentions. His critique was, I do present my own personal eureka moment in terms of what made me see what's going on operationally with where AI can facilitate and industrialize massive improvement. And his feedback point was, I'm just a bit concerned that you're effectively saying managers aren't good at what they do. And it's a tricky one, isn't it? Because I think the real life case studies bring it to life, but I don't want to alienate the people that I'm trying to, work with. So it's a tricky one. That maybe we come back to that in the next section where we're talking about, where I can improve things. Angus, do you want to go next?
Yeah, I want to come in, Anthony, because this is a classic example of the user not needing to know the details of what is happening. It's like getting into a car and driving the car. Most of us do not know how the engine works. In fact, we don't care. As long as the car gets us from A to B, we're happy. Now, yeah. I can tell you that having used some of the aspects that we are talking about, we are going to see AI totally transforming medicine. And I don't think the medical fraternity need to know the details. They do need to know the risks, and obviously people are focusing on that. But it is just like driving a car. You are given the vehicle, you get in it, you push the button, and it happens. Now, I'll give you a classic example. I wanted to write a letter to somebody in the royal household.
Yeah.
Gemini did that for me in 30 seconds. With all the details that are necessary to compose that letter, to produce it, and to put the right titles in. So I think we are moving into an area which is going to simplify medical care rather than complicate it. And I think we need to bring the managers on board to understand that.
Absolutely. I don't know what the rest of you guys would think, but for me, I put this in the book as well. I think AI is like other revolutionary things that have happened in the past. So the Industrial Revolution, electricity, computers, the internet. There's always that journey of fear and resistance, and that journey happens all the time. And I think AI is quite early on at those stages. So I agree, Angus. We will get to a point where it will be like driving a car, but at the moment there's still quite a bit of fear and avoidance, and we've got to take people through that journey. And I think that is the reason for the book, actually, is to try and give them that confidence that this isn't a black box and mysterious and it'll spit out all sorts of rubbish hallucination stuff. It can if you don't use it properly, but I'm hoping to guide people to say, do it like this and it will give you absolute quality.
Can I come in again, Anthony, just shortly, and then I'll shut up. But I think it's really important to understand how easy it is to use. And I do feel that there are no absolute experts in the AI field. There are people who are experts in little parts of the AI field, but they're not experts across the whole field. And many of us are totally self-taught. We've jumped on, we've tried to use Braun, we've tried to use ChatGPT, we've tried to use Gemini, and we've learned how to do it. Unfortunately, some of them are easier to use than others. We just need to encourage people to do that. There is a lot of self-learning.
Yeah, absolutely. In the book, I don't detail a lot of case studies, but I have mapped out a lot of case studies. And it's in the book, you get a link to go to my website for the resources. It's all free, but I didn't want to overload the book. I wanted it to be that quick one-night read, but there's so many use cases. It's incredible. And the other thing that I wanted to say in the book was to try and get people to get a sense of, there isn't just AI. There are literally thousands of products and potential use cases, and get people to think about AI as a strategic journey, so that different organizations will be at different levels to implement different elements of AI as they progress through that journey of organizational development. Jose's just dropped out. I'm just going to let him back in. Sorry, 2 seconds. Fantastic. So if we just go over to you, Rebecca, for your first thoughts in terms of where I am managing to meet those objectives in the book.
Well, I thought it was a great read, and I self-confessed in this room, you all know an awful lot more about AI than I do. So I'm probably one of the people that you want to convert.
Absolutely.
So I think what's really useful is that, from a psychological perspective, you can understand how fear and excuses form part of the disengagement, or I'm not doing, or it's that's for other people and not for me. I think the historical context helps you understand that actually, do you want to not be part of this? I mean, can any of us really remember the first day that we perhaps went on and used Google and the internet? Do we remember that? Do you remember your first day? But many people wouldn't dream of, I don't know, looking for some of the things that are fundamentally important to their lives, like a holiday, etc., without actually utilizing the web. So that's so entrenched in kind of the way that we do things. I think it's really about sort of starting to ask ourselves those questions. I felt you demystified AI, which I think is super important.
Yeah.
And actually, you gave the illusion, the impression, which I think is a really healthy one to have, is that AI will not do something to you. You are the master of it. And, that's what humans quite like, as in being in control. And actually, the way that you presented it helped people understand, as in, this isn't going to suddenly invade my life and do X, Y, and Z to me. It actually is an efficiency tool. And I think as we sit here as people who are really interested in the NHS and efficiency and delivering the best patient care, I'm not sure how we can potentially sit back and go, we will not engage with this something that could deliver improvements for patients. I also think that if we were to do a straw poll, and actually, interestingly, I did this in our organisation, who's actually using AI? If I use a model of my world or anybody else's world, which is nobody's using it, and then I go out and actually ask people in my organisation, what are they doing using AI? You would be astounded by the normal everyday uses of AI that people are using in your organization and patients. And I kind of think if that is what people are doing, then surely we need to lean in, read this book and start.
Yeah, no, absolutely. Angus might raise the point about the government official that's been, I don't know whether he's been caught out or he's actually updated people voluntarily that he's using AI. But yeah, I think
to be fair, Anthony, the New Scientist picked it up through our Freedom of Information approach, and they published yesterday a report on how Peter Kyle had been using ChatGPT for finding out some information and obviously trying to develop his own knowledge of how AI worked and how it could be used in government. So there's no criticism of that, I think that was potentially very beneficial. And we have already been told by our lords and masters in government that they are going to reduce the civil servants dramatically, partly because they're going to use AI. And I can see that happening very quickly.
Yeah, absolutely. Well, it needs to, doesn't it? And with all these NHS restructures and things that are going to go on, and we're overwhelmed and in chaos a lot of the time firefighting, we've got to change, haven't we?
Yeah.
And just drawing that back to Rebecca's point, it's almost an ethical point of we have to do this. We can't sit back and wait 10 years for this stuff to happen. We've got to be on the front foot. And for me, I think, I'll give an example as well in a second, but I think the governance teams in all NHS organisations have got to step up first, because they will be the bottlenecks. We will have users using it. I think there was a survey recently with GPs, even months ago, and there was over 30% of GPs actively using it to help them with diagnosis and all sorts of things. I bet you the real number's a lot higher than that. And yet governance teams will be, if we're not careful, years behind it, all of us that are actually using it. Just to give another example, so I'm, as you can tell, with all these events and all the work I'm doing, I am flogging myself to try and make a difference in the public sector. And I talk to lots of NHS people about this, and it's like, yeah, we think it's good stuff, and yet I'm just working with a large schools trust at the moment, and it's like chalk and cheese. It's like within 2 meetings we're actually running one, and I'm just today started to work on a bespoke genie for a very large UK known company that's private sector through and through, but they just get it like that and go, let's do it, let's try it. And yet the NHS is like just so far from that place. It's just incredible. I can't explain how far away they are. Maybe that's a brilliant segue into Paul, actually, just to go through this first round.
Yeah, just reflecting on a few things that were said there. Do you know, it took me back a bit. So my early career from leaving school was with Barclays, and this was in the late 80s, early 90s. And of course, banking went through the kind of transformation that healthcare, I think, needs to go through in terms of digitizing and sort of changing the way it views what people do versus what systems can help support. And during that time, and thinking about some of the fear factor that can come with this, I was made redundant technically 5 times, I think, in 12 years because of job changes, centralisation and all of that. However, the transformation of experience for end users, apps and all the things that we now take for granted when it comes to banking was absolutely necessary and fundamental. And I think as end users, we'd all endorse that and we wouldn't want to go back to the way it was. The other thing I was just thinking about was, I remember when I first, in my banking role, looked at Lotus 123 and had this grid in front of me and thought, what the hell is this? What happens if I type numbers into this box and what does that give me? And I couldn't dream now of years and years and years of Excel and spreadsheets and macros and goodness knows what. But I remember how alien that first felt to me when I looked at it and how completely all at sea I was. But very quickly that became a trusted tool and developed into things that we know and love and have evolved since. So I suppose there's something in this, certainly for me, of recognising that this is a similar sort of feeling. We're at the cusp of something that I think is way more transformational even than the stuff I've just talked about, and for the thing that's most important to all of us, which is our health. So it's a big prize to go for, and the fear is real in different ways, but we've got to grasp it and got to head for it, because it will happen to us if we don't take a lead in it. So as a concept, that's where I stand. And I agree with what you said there, Anthony, about from a sort of insight governance perspective, you know, how does my role and others around me and colleagues, how do we help our boards ultimately, internally and then presenting externally, understand our quality of care, improve our quality of care, understand user perspectives, patient perspectives on our quality of care, but do it in a much slicker, much more insightful, more meaningful way. And that's our job. And we've got to get to that. And I'm utterly convinced that really good data modeling is crucial. And then AI built to reach into the data that we gather from hundreds, thousands, at times millions of lines of data code across the healthcare system has to be the way into it, because we massively underutilize the rich data sources that we currently have in all aspects, whether that's the kind of front end clinical side, diagnosis, treatment, right through to governance, assurance, insight, change, improvement. So it's fundamental. So it's going to happen. It'll either be done to us or by people outside of us, or we've got to grasp it. So yeah, really agree with the discussions we're having.
Okay, fab. So just before we get into the critical elements where I can improve the book, I'll just pull up a few comments from LinkedIn. AI, thanks Evelyn. AI super users make more sense than AI experts. And I sort of lean towards this way as well, Evelyn, because my first bit of writing with the Fit to Care book, I'm trying to impress on people how much information there is out there and how impossible it is for any one individual to understand it all. We just can't. So I think by pulling together all the people in the organization, all the relevant stakeholders, and learning from them in terms of their expertise and bringing it all together in a bespoke way for a specific solution that's required is the way to do it. And that's a major part of the book as well. So thanks for that comment. And then on to Sue's. Could combine similar policies. Yeah, I mean, this is just another example of the number of use cases is exponential. It's absolutely insane. But before you can get your head into that, you've got to just get started with it and get comfortable that AI isn't dangerous if we do it properly. We can control it, as Becky said. We can manage it really well, but let's not run before we can walk. It's that journey of do the basics first, get familiar with it, understand the core principles, and then we can get really, really sophisticated and do more and more. I've not managed to have a look at Luca's post yet. I don't know if anybody else has.
Yes, I have. Can I just comment, because I think it's very relevant. One of the difficulties is that we are being provided with data and information, but as Luca has highlighted, that is not necessarily knowledge. You have to understand the information, you have to understand the data, and only by being able to understand it can you ensure that you are using and interpreting the information properly. A good example is garbage in, garbage out. We do know that during COVID, across in America, there was a lot of misinformation that was publicized widely on the web and would have been picked up by artificial intelligence. It was inaccurate, and we knew it was inaccurate. So you do have to know, as well as you do have to be knowledgeable as well as have the information.
Yeah, absolutely. And I still haven't had a chance to read it all, but I think the key, which is included in the book, and this is my personal experience from spending hundreds of hours using AI now and developing my own system, is the prompt engineering is absolutely essential. So it was a little bit, like just thinking, oh, AI is great. Everybody's saying AI is great. Let's just go into it, and I'll put one sentence in and expect the golden bullet to come out, and it never will. So I do a section around prompt engineering and some tips and tricks as to what to do and how to do it really well, so that you almost always get a very, very high quality response if you get the input right. I'll just come to mind. Again, this is just through using it a lot. Sometimes I'll get a situation where I'll write something and it will not give me the level of detail that it normally does. And I almost feel like it's lazy. And I tell it it's lazy. Stop being lazy. I've asked for this and you're not giving it me. And I think proper science, this is just my anecdotal evidence, is I think it's in the afternoons when the US market kicks off and everybody starts using it in the US. And it controls the amount of power that it puts through and tokens that it puts through to you. That's what I think is happening. But you only get to know this stuff when you're using it a lot and you become familiar with it. And I'll call it participatory knowledge. You have to have that participatory knowledge. And then it's a bit like having an employee and saying to the employee a one-line sentence about what you want to happen, the employee will almost certainly give you rubbish report or response back. Whereas if you say to that employee, here's the context, this is the background, these are the key players, these are the things we've got to think about, give it all that context, and then be really specific about what you want out of the process, the response from the employee will be amazingly much better. And it's exactly the same with AI. So thanks, Luca. Anybody else want to put in any questions as we go? That'll be great. We've just got one last more. One last from John Paul. The ethics of AI. So that's a good one. I haven't gone into this in too much detail, and maybe that's what comes out of this session, is that people might want me to include some of this in the book. The reason I haven't gone down this route is I just want it to be simple, short, easy to read, and just get people on this journey. So that's been my intention. But interesting. Shall I whiz around the panel? Shall we go in the same order? Andy, do you want to go first on this one?
Well, there's a question of, is the AI ethical or not, or is it the use that we put AI to and what it makes possible ethical or not? And I think certainly at this start point is probably the latter, and it's one of the things I was going to come up with later on in the panel discussion is what are we using AI for, and have we thought through that properly? Because it's the what are we using it for and the ethical implications of that then arise out of using AI to undertake that task. So AI, I think we can look at ethics through multiple lenses. What does it mean for the patient? And I think that's part of Luca's questions, which is what are we trying to optimize for? Is it for the benefit of the patient, or is it for our efficiency and bottom line metrics? And there's a tension there that we push down on one more than the other, then that there's ethical dimensions to that. So what matters to the end person, citizen, patient? Have we included that in our thinking? What matters to the healthcare professional? What is in the interests of the system itself, which is managing constrained resources? There are multiple perspectives that feed into local ethical questions and then systemic ethical questions. When you add all these things together, what is the right thing to do? So we've got lots of thinking to do that AI accelerates our need to get to grips with.
Okay, brilliant. So this has just prompted me. There is a section in the book which is basically giving you a criteria checklist of think this through before you undertake any AI project. What I'm now thinking is I need to revisit that just to check that I've put enough emphasis on the patient being the focus of what we're doing this for.
Yeah.
So I'll just check that whether I've done that sufficiently or not.
There's one other thing I'll quickly add in, which is we often do things because we think if we do this, then that will occur, and that's either good or bad. But quite often there are unintended consequences. And I think we need to get much better at thinking what else might happen if we do this that isn't the direct result of why we're doing it, but could be kicked into play by virtue of doing this thing. So what are the unintended consequences? We need to think a little bit more about that as we move forward into this area.
Interestingly, that's what I use AI for the most. is I'll have my thoughts and then I'll challenge AI to give me a critique on that and pull out those other unintended consequences.
Yeah.
Has anybody got any burning points they want to make on this?
I think if I can come in, Anthony, I think at the end of the day, you have to work out what is good and what is correct and what is bad. Our understanding of what is good and what is bad hasn't changed. However, as you say, things are moving so fast that we need to be aware of how we are drifting. And AI may well drift us into a territory which looks as if it's going to be ethically inappropriate. And when we are drifting in that direction, we have to stop. And I think that we are going to learn as we go along how to deal with that. But we do need to have some monitoring process that is in place to ensure that ethics are protected in the future.
Yeah, no, absolutely. I've also done another checklist that's a resource in the website because I didn't want to overwhelm the book on governance as well, which ties into that completely. I'm just conscious that we've only got 20 minutes left, and I think we could talk on this for 4 hours, I think. So is it okay if we whiz into because I'm really keen on this. The purpose of today's call is how we can improve the book. So shall we start with Becky on this one? And I'll try and make some notes as well.
So in terms of, we talk about participatory knowledge, and I think in some of the sort of ways we've talked about AI is in where there's fear in the system or fear generally about how do I engage with it? What will it be? What if it gives me this answer? What if it does this? And then we talk about ethics. I think we have to remember that as humans, we are active participants. You know, we are not giving up control to AI. We would in all of our jobs as responsible adults caring about patient care. You would be an active participant of anything that came across your desk and receive that information. And I think we could underline that a little bit. And I think in terms of, I appreciate everything that everybody said about ethics and agree with them. But I also think that sometimes if we play ethics at the front and center of this, it enables us to back off from it. And I think what we have to do with anything that is new, it is about continuous improvement and embracing a win or learn approach, and having that vigilance around what Angus was saying, when you are starting to notice something that may not be where the direction of travel you wanted to be in. If you're an active participant, you will take that on board as learning, and you will therefore autocorrect, move, change your policies, etc. If we have to kind of really embrace this, we are active participants of this movement, and therefore we will be able to influence. If I move to being passive, it's nothing to do with me. Well, what happens next is completely out of my control. The other thing is that I would actually encourage anybody, and I don't know, this may be too basic for your book, Anthony, but actually, if you've never used AI before, and I think there are loads of people out there that haven't, actually trying to do something really simple that's fundamentally quite interesting, which is ask it for a recipe, or even like plan your holiday. What's the ideal 3-day trip to Morocco? I know it seems basic, but if you want to remove fear, try something low level for yourself and actually see how powerful it is, because then you build up the confidence to try something else and bring it into the workplace. Because beside looking at the ethics, which are important, there are so many efficiencies here that actually could help us all.
Okay, brilliant. So I have got an example in the book, which enables you to get started. But I think I might just add an extra one in for people that have never even thought about AI and do the recipe example just to get them started as well. So just add another one in. Just whilst we're together and our heads are in the zone of ethics, given Rebecca's point then, should I include ethics as a little section or just leave it alone and that's for another book, another day?
No, you have to put it in. You do have to have a short section in about ethics.
Okay, but
it's really hard. Can I just say that I would just say there are ethical frameworks. They're all incomplete because AI ethics is an emergent field.
Yeah.
It's being determined every day by decisions that people make that have no right answer. Even if you've got every ethical framework there is under the sun and you've got them nailed to your wall, and machine learning operations teams are making decisions every day that the frameworks have no answer for. The most important thing is to document everything, document every choices, document the choice. The problem, I think actually most of the problem with AI ethics is that ethical choices are kept a secret. And that creates problems for other people.
And I guess it's moving so fast. These documents and process and protocols will be updating every day almost.
But you need 100,000 words to do the subject.
Yeah. Okay. So I think what I'm going to do is I'm going to do some research on it, provide a reference worksheet on that, and link that into that work, all the work that's being done, the best work that's been done so far, into a resource. Stick it in the website, and the book can point people to if they're interested in joining.
It'll derail the book if you go into ethics.
Yeah.
You have to mention, but it'll derail. It's too big.
Okay. Brilliant. Okay, then. So just going on a bit of a logical sequence. Andy, can you pull out things that you think I should improve, that I should focus on to make it better?
Yeah, there's three quick areas. I just want. It's very much an AI primer, and its value is that. And at this moment, for the reasons Rebecca outlined very well, I think this onboarding people into knowing what is AI, what it's capable of, playing with it, and then start to inspire the imagination of how we can engage with the possibility this makes possible in the workplace. But there are a number of areas emerging where AI is going to play a role. So that's anything from like up at the patient level and self-empowerment. There's some really interesting stuff coming through on AI there. This whole thing about triage and assisted clinical decision making, and diagnostics. There's huge bets there. There's lots of information. I think you touched on some of this about training and development. For example, in the health area, there's 1 million papers on health and biology published every year. There's no way healthcare professionals can read that. So there's huge amounts of value in AI and in surfacing new information in terms of continual professional development. Of course, how do we manage health and care and public sector institutions? There's a lot that we've been talking about here that plays a role there. There's what does the collective information provide us deep insight and knowledge about the public, and the evolution of health trajectories that then can inform new ways of doing things, that can engage industry and identify new problems that we can solve collectively. So there are many layers in which AI is going to manifest itself as value creating. I think one of the areas that it would be useful to draw attention to is that we have a very transactional, siloed health and care and public sector system. It's many people attune it to or describe it as a kind of sausage machine. We sort of put people in the front and process them and spit them out again. And there's a growing awareness, and certainly from the work I'm doing on systems thinking, is that we've optimized lots of bits of system to deal with bits of health problem and bits of social problems, and throwing bits at people isn't the best way of holistically supporting the population. So we've got a very transactional sausage machine model of doing things.
Yeah,
AI can be used to, how do we make that sausage machine spin faster?
Yeah.
But what we might be doing is more deeply embedding a broken model.
Yeah.
And there's a need to start to think about, well, what really matters to patients? What really matters to citizens? Can we start there and think about how we build and innovate new solutions, and how do we use AI in service of that? And that brings into play, I think, that a lot of the information to be able to do that is not in the transactional data of the sausage machine today.
Yeah.
What matters to people beyond the data that we're currently collecting? There's lots of gaps where real human story, human knowledge, human intention, the context in which people are struggling with isn't even present in the data we've got. So we've got to recognize and be a little bit more humble that just taking the data we've got and applying AI to that is going to miss out other sources of data we need to bring in to be able to improve the quality and the depth of the care that we provide.
Yeah. Okay. Brilliant. I think I definitely need a page at least on that. That is basically my first book, that Andy, the Fit to Care. Is basically that's what I'm trying to say in there, but I haven't really referenced it in here. But I think it needs a little bit. I'm just conscious I don't want it to get too big and too long. Okay. Fantastic. Just whilst we're on it, so I don't forget, when I referenced it earlier around my example, and could it be seen as being too critical for the people and want to try and work with and help? How does everybody feel that might? Paul's the obvious one to ask. Would your hackles raise and think, how dare he try and criticize us for what we're trying to do?
Not at all. I think if you've got a learning mindset, then no, I don't think so. I think it's the opposite. It's trying to reveal the art of the possible. And I'd be very surprised if anyone who's got a wide-ranging set of responsibilities in a large-scale organisation wouldn't welcome with an open arms, really, the opportunity to learn more quickly and to get deeper insight that's much better informed, not just by 1 or 2 or 5 people who can huddle in a room and try and come up with a solution, but actually, just as been talked about, actually, how can we access information from many people, whether it's about how we optimize processes from our colleagues across an organization, or whether it's from patients, users, public, about how we change services. And in our context, we're embarking upon a huge shift in bringing two hospitals together in a group, and looking at how we bring services together that have been, duplicated at both trusts. Well, we have to absolutely engage our citizens in that process at scale, and we can't just do it traditionally in the way of just having lots and lots of user groups, because the scale of change and the pace is too big. So we need to use tools like this to complement bringing people into a room and doing the more traditional stuff. And so no, I would never be offended by something like this. I would just see this is a learning opportunity. Let's embrace it and move forward. So not at all.
Okay, thanks.
And in fact, the example you give, I mean, we spoke about the example the very first time we spoke, and I didn't take it that way at all. I just saw the obvious reasons that illustrated the point you're making.
Okay, thanks ever so much. So just to close that one off, because I was contemplating taking that out, but did anybody read that section and feel like, oh, that's a little bit critical, and feel a little sense of that might annoy people?
Anthony, if I was sort of just from a psychological perspective, sometimes we're very good at actually like pushing back and saying, this is maybe you having a go at me, because that creates defense, and therefore it means that I can keep this knowledge out. So actually, I think what would be really useful is to say sometimes people have this response. And if you do have this response, just like sit with that response and actually ask yourself, what is that response about? And actually having to do some serious reflection on it, because there could be multitude of different reasons. As in, I'm just utterly overwhelmed. We're going through a reorganization, and you want me to think about AI or read a Get Started book, as in just actually be really open about it and put it in. And
I think that's a great idea.
This is critical. If we are all open, which hopefully we're in this sort of continuous learning and development, because learning is lifelong, then actually why wouldn't we want to embrace this and understand this, not just for me, for my team, for my patients? And I agree with Andy, underline that actually this approach, especially through Insight Genie, can actually maximize us hearing from lots of disenfranchised voices in our more diverse, deprived areas in this country, where people say we have done engagement with patients and we've done it really poorly, and we've done it in our own model of ourselves and our own cultural expectation. And I think that's where AI can really unlock better improvements in service design and improvements.
Okay, this is working really well. I'm getting some really nice additions that I can add in to make it a lot better. So really, really grateful. Angus, have you got any extra ideas for me to improve it?
When I'm carrying out a consultation with a patient, the patient wants me to empathize with the problems that they have. AI will never do that.
I'll come back to that in a second.
And I think it's really important to recognize the strengths of some of the things that are happening when you have a face-to-face meeting with somebody, and even having a video face-to-face meeting. It's the facial expression, it's the way that you empathize with them that is very important. If somebody has a very painful hip, they really struggle to get up out of their seat and walk around. If you say, I'm sorry that you're having such a struggle, what helps you, and actually empathize with the position that they're in, they feel so much better that somebody is paying attention. We mustn't lose that human contact. But what we do need to do is we need to avoid the need for the clinician to then spend half their time putting the information into the notes. And AI is in the process of transforming that, because I saw on a webinar on Wednesday, a consultant speaking to a patient, And that information, as he spoke to the patient, came up on the screen literally at the same time. And we are moving in that direction. And we've got lots of scribe programs available to help us with that. It's going to transform our outpatient clinics. And we really need to push for that in the future. But coming back to your book, Anthony,
yeah,
the audience perhaps don't realize that we've all been given copies of your book, and we are responsible for tearing it apart before it's published.
yeah.
My perception is that there is a degree of repetition in the book. It's a lovely book. It's a very good primer. There is a degree of repetition, and I'd encourage you to try and reduce that a little. But I like pictures, and I like the book being broken up a little bit so that you see a picture on a page, or you get a little case report. I don't like being directed to a case report somewhere else. I like, you don't need to do it too often, but an occasional case, an important, relevant case report in one of the chapters will make a huge difference to what you've written. But I've enjoyed reading your book, and thank you very much.
No, brilliant. So maybe we just pick up some of those points with the panel as well, just to confirm and get everybody's view on it. I'm running out of time, which I'm really upset about, because I feel like hours worth of talking we could still do on this. What I've tried to do is keep a structured approach. So I've done a structured approach in terms of these are the things that I've found from staff members in terms of, typical concerns and complaints. And I've used that throughout the book, but from different perspectives. So I've said, these are the real things. How can we overcome them in the solutions section? So I think it's a little bit, in my mind, it's a little bit, tell them what you're going to tell them, and then tell them what you've told them. There's a little bit of that going on.
Yeah.
But from different perspectives. So I hope there isn't too much duplication, because I've really tried to be conscious, aware of that. But I'm really keen on just gut feel from you guys if it is coming across as duplicate. There's a lot of duplication. How does it feel to the rest of you?
I think it was a level is fine. Some things need to be reiterated. I only have one quibble, and it just make the book longer. Defining AI assisted, AI driven, and AI powered at the beginning.
Yeah.
Because they're almost interchangeable. They're sort of interchangeable, but they're a little bit different. And you do talk about the difference, but actually just nailing it to the post at the beginning in the first act.
Okay. Brilliant. Thanks ever so much. So I've got so many things I wanted to really dive into Angus's point as well, because there's so many things, developments in terms of shared decision making and getting into that emotional intelligence that's coming online as we speak. But there's going to be an absolute mass of case studies that we can all tap into and we can all share. And hopefully it feels to me like, I don't know if people in LinkedIn can just do a comment on whether you think we need to do a bit more on these LinkedIn sessions where we can drill into this in a bit more detail. Let me know if you feel like you'd want to watch another one and we can get into more detail.
They do.
Okay, fabulous. I really appreciate it. There's been some gems that have come out of it, which I genuinely think will improve the book. So I'm really grateful. That is what the purpose of this is for. If anybody in the audience is interested, I've set up an AI strategic group where I'm updating my findings and sharing stuff as I'm researching and such like. So join that group on LinkedIn if you want. I think I can get this updated with the feedback points today in a few weeks. So I'm hoping to get it launched, the book launched on Kindle in first 2 weeks of April is my deadline. And it will be 99p for the first week or so. I haven't got into the settings yet, but I'll keep you posted on LinkedIn. But if you want it for 99p, then stay tuned. And thanks everyone. Really, really appreciated it. I didn't get to all the comments, but thank you, Jason and Sean. Really good points. I'll drill through them all later. It's bang on 1 o'clock. The first time I've chaired it properly. Thanks everybody. Really, really appreciate your time.
Thank you.
Great. Thanks for being part of it.
Thanks then. Bye.
Cheers.